My name is Caitlin Clark, and I'm an animal science pre-vet major here at Oklahoma State. Although I'm an animal science major, I'm pursuing a career in the pharmaceutical field. So for today's PowerPoint, um, we are going to research how effective the pharmaceutical drugs and treatments for cancer are. Here I listed a couple of cancer treatment options. The first two, chemotherapy and immunotherapy, are going to be the two that I focus on for today's topic, but I went ahead and listed radiation, surgeries, targeted therapies, and laser treatment just to go ahead and tell you or show you guys that there are other treatments besides chemotherapy and immunotherapy. We're going to go talk about the side effects of cancer treatment, how, why, what. Something that I actually learned through my research for this presentation that I didn't know too much about until now, that there are over 200 types of cancer. In my opinion, I kind of think that was a little low. I thought, we hear about cancer all the time, so I was pretty surprised to hear that there are around 200 types. Basically, what chemotherapy is the combination of medicines and or drugs to treat cancer. So the way, I don't know if all of you guys are very familiar, but the way cancer cells work is every cell goes through mitosis, cell division, so healthy cells and cancer cells. Cancer cells divide at a much quicker rate than healthy like bodily functional cells, the cells that we need to create all of the tissues working in our body right now. So what these cells do, these cancer cells, is divide very quickly until there's a huge mass or lump, and that lump is usually what turns into the tumor, and then also goes on to be cancer. So basically, chemo drugs just kill the cell that's undergoing mitosis. So they try and put a stop to it at the start. The one thing that I think a lot of people don't realize is there's one cell and it divides, but then those two divide. And so instead of a cell just doubling, it increases in number pretty rapidly, which sounds pretty straightforward, but I feel like a lot of people don't really understand the effect of how quickly these cancer cells divide. A lot of chemotherapy treatments can be given through injection, drip, tablets, or capsules. Basically, chemotherapy is a systemic treatment because it circulates through the bloodstream and can reach cells almost anywhere. A couple that I have listed right here, the way that chemotherapy drugs attempt to kill cancer cells. Most of them can either attack the cell's control center, so like right here, the DNA, and then or they can attack or interrupt chemical processes on the cell surface. So they'll stop these chemical growth factors or cancer growth factors from invading the cell and making it replicate into these bad cancer cells that we don't want. So these chemotherapy drugs, they positively alleviate cancer symptoms and create its own. So that's kind of one thing that we're taking these drugs to alleviate symptoms that were far worse than the symptoms that the drugs are giving us. So right here is kind of a little illustration. As you can see, these little green circles are the chemotherapy. Here's the healthy cells and then your cancer cells undergoing mitosis. Basically exactly what I just said. These chemotherapy drugs are killing both healthy and the cancer cells. So the side effects of chemotherapy vary, of course, from patient to patient. But with chemotherapy, the one thing that I realized through research is similar side effects with chemotherapy are the same regardless of treatment type. So that's something that I really didn't know and something that I kind of feel like a lot of us wouldn't have known. The first side effect that I have listed here, alopecia. This is hair loss, what most of us are typically associate with chemotherapy. I listed a couple other ones: infection, nausea, vomiting, fatigue, psychosocial impacts I thought was very interesting. In one of my studies that I read, most of cancer patients listed psychosocial impacts as one of their number one effects, or one of their number one effects that it affected their life with their significant other, their family, things of that sort. Depression and anxiety, loss of appetite. And then over here, I actually took these pictures. This is of my roommate who's undergone. She went throughout 12 treatments of chemotherapy. These are side effects can be long lasting or apparent, I mean, just while you're taking your or undergoing chemotherapy. So this is an example, Raynaud's is an example of a longer lasting, I mean, she ended her treatment, I guess, in the summer, and this is still going on now. What happens is it's just the restriction of blood flow. So the blood's not getting to her fingertips. It's mainly when she's cold or anything like that. And as you can see, they turn white, numb, no feeling at all. So just another effect there. These right here, I read through a study, they're the top three chemotherapy cancer drugs in 2011, which I know 2011, now it's 2014, but it's kind of hard with all of the drugs in and out of the market right now and prices and things like that. This is the most stable and well organized list that I could find. So, Rituxan, the first one, this is the number one. All of these are made by Gentech, which is a highly accredited manufacturer of drugs. So this drug raked in $3 billion in 2011, and its main, I'm going to list the main cancer that all of these treat. This one is non-Hodgkin's lymphoma, and this is the drug that really transformed cancer treatment. In 2011, it had a 9% increase from 2010 in just bringing in, money and patients almost requesting this drug. So Avastin, the second, it treats colorectal cancer, and then Herceptin, the third one. This is to treat breast cancer, and this drug has left behind a huge, huge legacy. This is one of the first targeted cancer drugs, and it's aimed at the patients whose tumors have specific genetic characteristics between between their replication. And so that's, like I said earlier, the cancer cells are replicating at a much higher speed than our healthy cells. So that's going to lead us into our next topic, immunotherapy. Immunotherapy is new, being researched right now, really undergoing a lot of studies, trial and error right now with immunotherapy. We're going to talk about two of them right here. So basically, what immunotherapy does, it uses our body's immune system to fight cancer. So it boosts our immune system to seek out the cancer cells and take care of it on its own, rather than giving us drugs and other ways to kill the cancer cells. So it stimulates our body basically to work harder and smarter so that it can attack the cancer cells on its own. And immunotherapeutic drugs, they're really kind of designed to unleash the body's own immune system against the cancer. And they're recently proving to be significant, and they really have been increasing the life expectancy of those with hard to beat cancers, the very metastatic cancers that, you live a couple months to years after that. So a lot of these immunotherapeutic drugs, that's what they kind of target towards. So right here, this is a recent study actually. It was just presented this summer. It's research that was presented at the, I think, American Society of Clinical Oncology. And what happened right here is a couple melanoma patients, they received a combination of these two immunotherapeutic drugs that were on the market at this time in just a clinical trial. They lived an average of more than 3 years after they had received this drug, which is extremely, extremely promising, because most patients with melanoma only are expected to live up to a year after cancer treatment, which is a huge increase. I mean, that's a triple expectancy, which is something that's really exciting, and I believe something to celebrate, that we're unleashing all of these new drugs. 70% of these patients were still alive after 1 year of treatment, which is pretty neat. I mean, that's obviously more than half, but something that I didn't know, and something that I find to be very promising for future cancer drugs. This trial was conducted. This trial was used for not so much the intense. This is for more of a like lower grade. I don't really know the correct terminology for that. Not as a long-term melanoma, one that they caught kind of early. And what they did the exact same thing, gave these immunotherapeutic drugs, and it had a great effect, but kind of a reverse effect as well, cautioning the use of these immunotherapeutic drugs. They were early stage melanoma patients, and once the tumor was removed, their reoccurrence was reduced by 25%, which again, I mean, any reoccurrence reduced is something very exciting and something to be happy and praise, but also for these patients, this came with a very high cost. The side effects for these patients were so severe that about half of them had to discontinue treatment and 5 ended up passing away from treatment related conditions. So that's why these are all these immunotherapeutic drugs are still undergoing constant research, constant trials. But as time's going on, I mean, all of these studies are, like you have seen, are producing more and more promising effects, and something that we will definitely be looking to a future of immunotherapeutic drugs. There's a couple statistics that really do prove, we with the positives and negative combined, these numbers are the proof. I mean, 1971, 33 million cancer survivors, and today 4.5 million cancer survivors. So this proves that we are unleashing major treatments that are working, and we are improving daily on our cancer treatment strategies. So I truly do believe that through cancer treatments, whichever treatment works best for, of course, the diagnosis, but they really do increase the quality of the cancer patient's life.